Hi, I'm Lori La Bey with Alzheimer Speaks, and I have been a caregiver for both my parents and many, many others, both professionally and personally. So I want to ask you a question. How well do you sleep at night? For most caring for another, the answer is usually they don't get a good night's sleep. They're concerned about their loved one possibly getting up during the night, having to go to the bathroom, or hungry, or get lost, or disoriented on time or day. Depending on who they're caring for, they might be worried about a loved one falling or slipping in urine or trying to take a shower themselves or eating something that they shouldn't because they're diabetic or leaving the house or taking the car. The list goes on. Many care partners talk about how their loved one sleeping patterns get turned around and they sleep during the day and not during the evening. And that leaves the care partner really vulnerable and in a very difficult situation when they're caring for them. It's hard to be responsible for someone when you're asleep and they're not. Most partners say that they really try to sleep, but again, it's difficult. And they have guards on duty, but the guards on duty are their own ears that are on high alert, listening for any unusual sounds, and one eye peeking open, making sure that there's no movement in the house. Not getting enough sleep puts us all on edge, makes us tired and snappy, and if we're honest, sometimes even feeling resentful. Did you know some medications can change sleeping habits too? But other times it can be due to incontinence. Sometimes people have the urge to go to the bathroom when they really don't have to go. Or maybe they're uncomfortable because they did void in a brief and now it's leaking onto their clothes, into their bed, and they can feel it on their skin. Or maybe it's the odor caused by the incontinence, or even an irritation or soreness of skin breaking down. All those things can come into play. Sometimes it can just be the fear or embarrassment of them consciously not wanting to have an accident, and they're trying to avoid it, but they don't tell us that. And at times, I know as care partners, we all think, well, we just won't give them water. That'll be the answer. But keep in mind, that can cause a lot of other issues. So you're going to want to make sure to check with your doctor first on that. Some issues that can come into play when we withhold water is low energy, headaches, sluggish bowels. People can get disoriented when they aren't hydrated well. Lack of hydration can increase the odds of a bladder infection because it's not removing toxins in the body. And that can be really dangerous, especially when we're dealing with elders. Some people get shaky and off balance, so that can increase falls. Dry mouth, some people gain weight because they're eating instead of drinking, or our minds can get foggy. There's greater odds of somebody having kidney stones or even issues with heart valves if we don't stay hydrated. And then, of course, there's the itchy skin that can drive us all crazy. That's where Seni can come and help you out. Did you know there's different types of briefs and products that can avoid a lot of these issues? I know when we go to the drugstore, you just get in the aisle and there's so many things, it gets overwhelming and you don't know what size to pick and you don't really know anything about the product, but they actually have people that will talk to you and they have sizing requirements and kind of little tests on their website to help you. For example, there are nighttime products that are more absorbent and they wick more water away from the body so it feels drier. Sunny has these more absorbent nighttime briefs that lessen the likelihood of skin breaking down and bed sores occurring. They have a vapor lock, so it allows the skin to breathe, which also reduces any skin irritation. And they have leak guards that prevent clothing and bedding from getting wet. There's also skincare products that can help protect the skin from breaking down. So let Sunny help you both get a better night's sleep because studies have shown that sleep is really important to us. In fact, there was new research out that they've been talking about a lot, saying getting 8 hours of sleep can actually help fend off dementia. And we all know, but a lot of times forget that when our body is well rested, we function better. We're physically stronger, we're mentally more alert and attentive. Emotionally, we can cope with those everyday stressors that occur. Lack of sleep can actually impact what we see and what we hear. It changes our perceptions when we're not totally attuned. So implement Seni's game plan into your care plan and let both of you get a better night's sleep.